Hey there, everyone. Mike Meebeck with KTVU Fox 2 in the San Francisco Bay Area. Today, we are dialing in on convalescent plasma and COVID-19 and the shortage of that specific plasma. To talk more about this, we're joined by Dr. Catherine Mazii, Medical Director of the American Red Cross, Northern California. Doctor, thanks for being with us for the discussion here.
Well, thank you. And it's a pleasure to talk about this very precious resource.
Yeah, something crossed my email and it says emergency, it says shortage, and then it says, convalescent plasma. And it caught my eye because mainly the words convalescent plasma, I didn't know much about it and why there is a shortage of it. For those also across the country right now who don't know what this particular plasma is, can you just kind of dive into that real quick?
Absolutely. And that's a good question. So what convalescent plasma is when you take a person who's been infected with a disease, and as they recover, their body makes antibodies to fight the disease. And so those antibodies are circulating in their blood for several months after they're recovered for their illness. And what we're able to do is using the same technology that lets us collect platelets from a donor, we can collect the plasma and therefore all the antibodies that are swimming in the plasma and give that to a patient who is sick with coronavirus and hasn't made their own antibodies yet.
Okay, so, and I'll use myself kind of as an example, I guess, but if I fought off the infection, the virus, um, the plasma contains COVID-19 antibodies always, like it's guaranteed that I have them or not?
So that's the $64 million question,
Right.
right?
Okay.
Currently in this country, there's a shortage because we honestly don't have a lot of good other treatment options. And so everyone's participating in trials and studies testing out this convalescent plasma to see if it works in this case. We do know it worked in the past for things like Ebola. A few years back, we had some physicians that were working overseas and became infected and came back here and were treated at various hospitals and recovered using the same convalescent plasma approach. So that's why we're trying this for coronavirus now.
Here we are 4 months in or so, and I don't know if you know the answer, but do you know like what percentage of patients who maybe have received this plasma have responded to it, and that you can say, hey, is it working, I guess?
It's really hard to tell right now. It's still very early on. There's a lot of questions we don't know, and that's what the studies are trying to answer. We don't know what a good level of antibody in a donor is. We don't know how many doses it's going to take to treat the patient because, of course, this is experimental, so they're also receiving all the other medications and things. But early data from the Mayo program, which is doing an extended access protocol where they head up the research study and any hospital can register patients and give them convalescent plasma. So their early data shows that, first of all, it's just as safe as regular plasma. So the safety trial part is proven, and there's also anecdotal evidence that the earlier they give it in the patient's course, the better the patient will do. So that's very encouraging, and I think that's what's driving the demand.
And anyone who has fully recovered can donate, or there are kind of limitations here on who exactly is eligible?
So our eligibility criteria are on our website. If you go to redcrossblood.org, you'll see a big banner that says, have you had coronavirus or want to give COVID plasma? But so what we do is you go to our website and you complete a donor request form. Now the eligibility is the same as for any other blood product. So you have to weigh at least 110 pounds, have to be at least 17 years old. For this, you have to have coronavirus and have had it proven with a test. And then you'll fill out the form and someone will get back to you right away and they'll go over the criteria and set up an appointment for you at the closest location and explain the procedure. It does take a little bit longer than giving a unit of whole blood because, as I mentioned, it's the technology we use to collect platelets. And what happens is that it's a completely sterile single-use setup and it draws the blood from your arm and it spins it around really fast so that it separates and they take the plasma and give you back all your red cells.
Huh.
So
that's interesting. Nice technique.
yeah, well, and by doing that, we can treat up to 3 patients with 1 collection of convalescent plasma because we can separate it into 3 doses.
Oh, that's great. I was going to ask you, what the number was on how many can be treated with one donation there. You briefly mentioned it, but when it comes to where, so people watching right now, where can I go? Is there a specific place within the Red Cross, set up around the country that I have to go? Do I have to go to a hospital? Where is this done?
So Red Cross is collecting in all of their, what we like to call a fixed site. So anywhere where it's a building. So right now we're not going to drive a bus up to a parking lot and collect it there, but we collected at any of our sites in the area. And when you go online and enter your information into the form, they'll be able to direct you to the closest site to where you live.
Okay. If I haven't tested positive, just to clarify, I know you said, you have to prove that you had a positive test, but if I haven't tested positive and say, hey, I want to still try to donate, that's not a possibility, right, doctor? You have to have a positive test.
Well, actually, we've been testing the convalescent plasma since April, but in June of this year, we started testing all of our blood donors.
Okay.
And so we test every blood donation. We do an antibody test, which will let our donors know if they've had or possibly been exposed to coronavirus so that they know for their peace of mind and their families. But then the other thing with that is we can invite anyone who has donated and turns out that they are positive for the antibodies, then they are eligible to go ahead and become a convalescent plasma donor and help in this time of crisis.
Okay, great. You mentioned blood supply in general, and since I have you, Dr. Mazie, has the country taken a hit in just general blood supply since the beginning of this pandemic?
Oh, absolutely. And the only saving grace was very early on, hospitals were cutting back on elective surgeries, trying to save those beds for the coronavirus ICU patients. But as the months have gone by, hospitals are starting to perform more and more of those surgeries because they're not so elective anymore. So we've definitely seen blood usage go up in the area hospitals.
No. I mean, it's hard because you mentioned that the whole, the bus coming up, and I know at my workplace, and I haven't been there since March, but, we would have blood drives, but no one's there to do that anymore, or libraries or schools.
Right.
To me, that's the biggest, well, maybe it's not the biggest, but that's, the biggest obstacle, or one of the obstacles in trying to get people to donate.
Yeah, definitely. And with the California schools not really coming back on the schedule, that's a huge hit. We really relied particularly on the universities as a source of dedicated young, healthy donors.
Yeah. Okay, not to go back to the plasma, but since March or April, do you have a number of how much of this convalescent plasma has actually been distributed, I guess?
Yes, we've collected and distributed over 20,000 units of convalescent plasma. And I can tell you that there's a little bit over 4,200 units that were distributed just here in Northern California.
Okay. And excuse the question, but is 20,000 units considered a lot, or, when it comes to this plasma, or is it middle, high?
It's as much as we could get.
Okay, I see.
All of the blood centers worked as hard and as fast as they could to get as much of this product as they could.
That's awesome. Okay,
and
great.
Continue to do that.
We need to keep it coming because even saying that, we know there is that shortage, so we need more convalescent plasma. Dr. Catherine Mazie, Medical Director of the American Red Cross Northern California, thank you for the discussion. Thanks for all you do. Just on a personal note,